Do you feel sad after giving birth? Do you feel like crying all the time? Do you feel restless? Do you feel difficulty bonding with your baby? Do you feel exhausted? Do you want to know if all these things are normal? Keep watching till the end of the video to understand more about postpartum depression and its coping technique. Hello everyone, welcome back to Happy Pregnancy with Aarti. This video is a must-watch for all the expecting parents out there. I am Aarti Manikandan, mom of two and a Lamar certified childbirth educator. I am passionate about educating and empowering pregnant couples throughout the journey from pregnancy to parenthood for the fourth consecutive year. Picture this, the arrival of your precious bundle of joy. It should be a moment of pure happiness, right? But for many moms, it's anything but happiness. They might feel insecure, feel very sad, or even cry and be anxious most of the time. These things are very normal up to a certain extent. But when it crosses the limit, then it is called postpartum depression. So let's see what postpartum depression is. Postpartum depression is a medical condition that many women get after having a baby. It is more than just feeling down. It makes every day feel like a battle. It is strong feelings of sadness, anxiety, tiredness, restlessness that can last for a long time after giving birth. This might make it hard for you to take care of yourself or even your baby. Let's unpack why postpartum depression matters in simple terms. It is about recognizing that moms need support, understanding, and care during one of the toughest times in their lives. Stick around as we explore why understanding and acknowledging postpartum depression is crucial for the well-being of the mom, baby, and the family. In order to identify postpartum depression, we need to understand what baby blues are, or sometimes called as postpartum blues. Let's dive in to see a little bit about postpartum blues. Baby blues are the feeling of sadness that you might have in the first few days after giving birth. According to ACOG, 4 in 5 women have baby blues. These baby blues are caused by the hormonal changes that happen in your body after giving birth. After delivery, the amount of hormones, estrogen and progesterone, decreases rapidly. This causes mood swings. Not eating well, not having enough sleep can add to these feelings. It can affect new parents of any age, any income, and any education level. Few pointers that describe baby blues. Your mood swings quickly from happy to sad. For example, one moment you're proud of the job you're doing as a new mom. The next moment you're crying that you're not up to the task. You might feel irritable or even overwhelmed. Don't worry if you feel any of these. It is very common for new moms to feel this way. These baby blues usually go away on their own and they last only for 2 weeks after delivery. Eating well, getting good amounts of sleep, having a good support system can help alleviate this baby blues. But if you notice that even after those first 2 weeks, you're feeling still sad and irritable and it is not getting any better, it means the baby blues are evolving into postpartum depression. This kind of depression usually starts around 3 weeks postpartum, but it can show up anytime in the first year. It is more severe and lasts longer than baby blues. About 1 in 10 new moms get into postpartum depression. This postpartum depression is more common among certain groups, such as first-time mothers, mothers of preterm babies, people who lack support system, and people who have previous condition of depression. Even though statistics say that only 10% of the women get postpartum depression, we don't have a realistic view of the situation because most of the cases goes unreported. If you think you have postpartum depression, don't hesitate to discuss how you're feeling with your care provider and get help. Now that we have learned about baby blues and postpartum depression, let's dive deep into differentiating them. So, the woman with baby blues might be anxious or restless, can be sad too. But the woman with postpartum depression will be sad all the time. Like there will be an overwhelming sadness and in a panic mode all the time. Women with baby blues will cry for no reason. That is normal for women to cry because of the hormonal changes. But if the woman is crying all the time and not able to feel happy anytime, then it could be postpartum depression. New moms with baby blues will have mood changes. But if this mood change is very extreme and it is causing some physical changes as well, like they don't want to eat anything, the appetite changes, then it could be postpartum depression. Moms with baby blues might feel sad. But if you have scary thoughts about yourself and your baby, then it could be postpartum depression. This is an important differentiation that we should know. Women with baby blues will have this symptom starting around like 1 or 2 days after giving birth, but it will usually go away within 2 weeks after birth. But women with postpartum depression, the symptom starts around 1 to 3 weeks after giving birth. It can start anytime in the first year as well, but it needs treatment to get better. If you feel that you have any one of these identifiers in the postpartum depression, do contact your care provider right away and get started on a treatment plan. Your healthcare provider might talk to you about your feelings, thoughts, and your mental health and help you determine if you have a short-term case of a baby blues or a more severe form of depression. If identified for postpartum depression, a treatment plan is necessary. Postpartum depression is usually treated with psychotherapy or talk therapy or mental counseling, and medicine or sometimes both. It depends on the severity of the condition. If left untreated, this condition can last months or even longer. Now, let's see more about psychotherapy. A method of psychotherapy called cognitive behavioral therapy is often an effective treatment plan for women with postpartum depression and anxiety. The treatment is usually short-term, around 14 to 16 sessions. Therapists will help you identify these unhelpful thoughts, feelings, and behaviors. They will also help you with identifying the triggers for the depression and dealing with them. You will also learn different ways of thinking and reacting to situations that trigger depression. Therapists teach behavioral activation, which involves scheduling activities such as doing some exercises, doing some social activities, or even just going out for a walk that makes you happy. You might also have sessions with your partner and finding ways to improve communication between you both so that you can ask for help when you need it. The next form of treatment available is the antidepressant. Your care provider might give you a prescription for antidepressant depending on the severity of the condition. However, if you are breastfeeding, most of the medicines which you take will enter your breast milk. But the good news is that most of the antidepressants can be taken along with breastfeeding as they have very less risk for the infant. Do not take self-medication. Always talk to your care provider about how you feel. If you know anyone who is having these symptoms of postpartum depression, encourage them to seek help. In the next section, we are going to see about the coping techniques for postpartum depression. Remember that postpartum depression must always be treated by a therapist or a mental health provider. You can do the following things for prevention if you are at high risk for postpartum depression. Also, you can do all these things as coping techniques if you are identified for postpartum depression and then treat. Number 1 is nutrition. Evidence suggests that there is a direct link between good nutrition and postpartum depression. For instance, deficiencies in the nutrients like B vitamins, vitamin D, omega-3 fatty acids, and zinc has been associated with depressive symptoms and are at high risk for postpartum depression. Our brains need healthy nutrition and protein to function effectively. In fact, the feel-good hormone serotonin is not naturally occurring in our body. They are produced from the amino acids that we consume while we eat. Well-balanced diet with adequate protein is essential for optimum mental health. In fact, the following foods will help you with reducing the symptoms of postpartum depression. They are salmon, egg, poultry, spinach, nuts, soy products, and some seeds. Continue to take prenatal vitamin even after giving birth. It is important to remember that diet cannot cure postpartum depression, but it can help alleviate the symptoms. Number 2 is water intake. Oftentimes, when looking to improve the mental health of a person, the first things that come to our mind are meditation, yoga, and therapy. But the effective ways are much more simpler. One such way is to simply remain properly hydrated. Research suggests that there is a link between dehydration and anxiety. Moms who are pregnant, who just gave birth, who are breastfeeding are especially at high risk for problems associated with inadequate water intake. Aim to drink at least 12 cups of water a day to stay hydrated. If you are a nursing mom, drink at least 16 cups of water to compensate for the extra water that is used to make milk. So drink up, mommies. Number 3 is healthy sleep routine. Though there are various factors contributing for PPD, sleep deprivation can exaggerate the symptoms of it. Parents of infants who are more difficult to soothe and who wake up more frequently at night appear to suffer more symptoms of depression, anxiety, and fatigue. Women with poor sleep during pregnancy are more likely to develop postpartum depression after childbirth. It is important for women who are already at high risk for postpartum depression to prioritize sleep during pregnancy. Women with prior mental conditions, adequate sleep can prevent relapse. Even though it is hard to get good amounts of sleep with a newborn, consider getting at least 4 hours of uninterrupted sleep at a minimum. To increase the nighttime sleep, consider alternating nighttime childcare duties with your partner or a family member. Number 4. Exercise. In a large study spanning 11 countries, suggests that regular bouts of exercise can help treat and prevent postpartum depression. Women who exercise are less likely to be depressed. In your early postpartum, consider doing mild movements and stretches like going for a walk or doing a mild household activities. These things can help you increase the endorphin levels and reduce the stress hormone cortisol. Later, when you get an okay from your care provider, then you can do some aerobic exercises like swimming, cycling, running, and some other sports-related activities. Research suggests that these moderate-level aerobic exercises can prevent postpartum depression. Remember that your body needs time to recover, so do it at your own pace. Number 5. Support system. Inadequate support system is one of the leading cause of postpartum depression. A postpartum with new baby by itself can be overwhelming. You need a proper support system to lessen your load. Be it your partner, a family member, or a friend. Do communicate your needs to them. Ask for help instead of doing everything by yourself. Consider setting up a meal train with your friends, family, and colleagues. They can bring you food in the weeks after you bring baby home. If you have struggled with depression or anxiety in the past and know that you are at a high risk of PPD, then connect with your reproductive psychiatrist when you are pregnant so that you can continue these mental health sessions even after childbirth if necessary. Attend a childbirth class to understand what could happen during postpartum. Being prepared is a key to avoid anxiety. Learn about the symptoms, risk factors, and the treatment options available for the newborns and have a game plan in place even before the need arises. Educating yourself on the postpartum mental health is the first step in preventing postpartum depression. If you want to empower yourself with knowledge and reduce your risk for postpartum depression, do attend the Lama's class. You can look at my Instagram happypregnancy_RT for the latest class information. Number 7. Relaxation strategies. Becoming a new mother and having a new baby can be stressful at times. New moms who have access to these relaxation strategies are less likely to be depressed and be anxious than the mothers who do not. Here are a few stress reduction strategies that we teach in the Lama's class. Number 1 is breathing. Do a relaxation breathe with your full lung capacity. So what you do here is breathe in through your nose and breathe out through your mouth at the full lung capacity. I'm going to show you how to do that. By doing this, you are providing your brains with enough oxygen to function efficiently. The next technique is called progressive relaxation. You could either sit down in a comfortable position or even lie down and then tense and relax every part of your body from head to toe or toe to head. Notice how it feels like to be tense and how it feels like to be relaxed. For example, if it comes to my hand, I would like to tense my hand like this and then relax it. So I will do that from toes to my head. Once you have gone through your entire body from toe to head successively, tense and release your entire body at once. This is a great technique when you have difficulty falling asleep. Everything possible to take care of yourself isn't a guarantee that you cannot have PPD, but it could ease the symptoms. If you're a mom who's recovering from postpartum depression, know that these strategies can help you thrive one baby step at a time. You can download the Edinburgh Postnatal Depression form on the link in the description. If you're either pregnant or recently gave birth and you want to know how you feel, you could fill out the form. If your score is about 12, you're likely to be suffering postpartum depression and do get a medical help. If you have been through baby blues or postpartum depression, join a supportive community and share your experience in the comments below. If you're interested in knowing the surprising facts on C-section, do check out my video on decoding C-section myths. Whether you're a new mom, a concerned partner, or someone who's aiming to understand postpartum depression better, do reach out to me on my Instagram happypregnancy_RT. Don't forget to like, subscribe, and hit the bell notification for more pregnancy and parenting content.